Today we will take a look at how aging impacts the stomach. The stomach helps digest food, mechanically and chemically, to create chyme. The stomach is divided into 4 anatomical regions: the cardia, fundus, body, and pylorus. The fundus and body share the same histology. With age, the stomach size and capacity decline. This reduction in gastric volume can lead to early satiation. In this set of slides, we can see what different parts of the stomach look like during endoscopy. Altered gastric microbiota, reduced mucosal protective mechanisms, decreased gastric blood flow, and consequently compromised repair mechanisms are the hallmarks of age-related gastric changes. Among the comorbidities frequently encountered among older people, Parkinson's disease and diabetes mellitus seem to have the greatest impact on gastric emptying. Loss of cholinergic enteral neurons as the most plausible explanation for decreased motility or gastroparesis in older adults. Chronic atrophic gastritis is more prevalent in older adults and is associated with H. pylori infection. The hallmark of the disease is the partial loss of glands in the gastric mucosa, leading to hypochlorhydria or achlorhydria. While advanced age was thought to be independently related to chronic atrophic gastritis in the past, current data support the theory that atrophic changes of the gastric mucosa are associated with H. pylori infection, rather than the age itself. Recent studies suggest that eradicating H. pylori infection in elderly patients may prevent progression from CAG to intestinal metaplasia and gastric cancer. Antral gastritis leads to duodenal ulcers, whereas corpus gastritis leads to gastric ulcers. Very deep ulcers can erode underlying blood vessels, and may even erode all the way through the wall of the stomach, or duodenum, in particular, causing a perforation. Most ulcers are due to NSAID, or H. pylori. Any dose of aspirin is equally able to produce ulcers. While 90% of NSAID ulcers occur in the stomach, there is about 1% incidence of ulcers occurring in other parts of the GI tract, including the colon. The physiologic changes associated with old age include reduced blood flow through the GI system and decreased secretion of key components of gastrointestinal protective mechanisms such as bicarbonates, mucin, and prostaglandins. Gastric acid secretion is unaffected in healthy elderly. Adenocarcinoma is the most common type of gastric cancer, and it originates in the columnar glandular epithelium. Adeno-CA is further divided into 2 subtypes: intestinal, or well-differentiated adenocarcinoma, and diffuse, or undifferentiated adenocarcinoma. Thank you for listening to this presentation.